Okay, moving onward. Diseases of the coronary artery. Now, remember, the coronary artery is the artery that feeds your heart, or the arteries that feed your heart. So, coronary artery disease is a narrowing of the coronary arteries that supply oxygen and nutrient-filled blood to the heart muscle. Remember, we said that the heart muscle is continually moving, so it needs its own supply of blood because it needs constant oxygen and nutrients. So, what happens is you can have narrowing of the arteries, and that can happen from a plaque buildup. If you eat a lot of fatty foods, you don't watch your cholesterol, it builds up in the arteries of your heart. Remember, we talked about LDL brings newly made cholesterol to your arteries, and HDL takes it away and brings it back to the liver to be destroyed. So, if you have too much LDL, your arteries are getting lined with plaque, and that's what causes the um, narrowing of your arteries. It can also lead to arteriosclerosis, which is when you have hardening of the arteries. This complete blockage can lead to a myocardial infarction, and that can result in death. Prevention is key. No smoking. Increase your exercise and reduce your cholesterol by eating the right foods. Eat a healthy diet full of lots of low fat vegetables and fruits, things that are healthy for you, and that can help with it. Angina pectoris. So this can often be the result of some narrowing, where the chest pain that arises when the heart doesn't receive enough oxygen. Now, this is a symptom more than a disease. If you're having angina, you think you're having a heart attack, and you go to the hospital and they say you have angina. There's two ways to treat it. Either you have to have it surgically treated, or what they'll do is they'll give you nitro. Nitro is a vessel dilator, and it dilates the vessel and makes more room and stops the pain. So it just depends on what the cardiologist or the thinks of, what you need. Maybe you're not ready for surgery yet, or maybe there's a reason why you shouldn't have surgery. So they'll give you nitro, and this is, because angina doesn't happen all the time. It just happens sometimes. So you have these little pills, and you take the pill, you put it under your tongue, and it dilates your artery. This pain is the pain that radiates down your left shoulder and down your ulnar nerve. People can feel it in their jaw. Um, Women are different. Women sometimes don't feel any chest pain. They get a hot burning sensation in their back, shoulder, arms, or jaw. It's a hot feeling, but not actual chest pain. A myocardial infarction is a heart attack, and that is a lack of blood supply to the myocardium. If it is a complete block of an artery, you may have enough blood in the other arteries, but you're going to cause muscle damage, and you're going to feel it. It's going to hurt. But sometimes the blockage is so bad that the heart attack is fatal. Myocardial infarction is caused by a lack of blood supply, so it can be due to a clot. It can be due to coronary artery disease. It can be due to arteriosclerosis. So for some people, it's not necessarily a plaque. It's just that the walls get hard or they get thicker. And it can be from atherosclerosis, which is a plaque buildup. People who say they feel like they're having a heart attack will often say things like, it feels like there's an elephant sitting on my chest. It is a crushing, severe pain. People who have this also, there's nausea and vomiting, heavy sweating, fatigue, and difficulty breathing. I've witnessed this where I walked into a room as an LNA, and a friend had already reported to the nurse in the morning. There was a gentleman on the unit that night who was sweating, vomiting, and complaining of chest pain, and the nurse just ignored his symptoms and said, you have the flu or you have a virus. It turned out he was having a massive heart attack, ended up in the ICU. You never ignore signs like that. Women, it's a little more difficult because they um, don't have that chest pain. They have what's called a silent MI, and that can be discovered the first time you have an EKG. The doctor will say something like, hey, you've had a heart attack before. They can tell because when your heart muscle is damaged, the electricity doesn't go through it the way it normally does, and they can see it on an EKG. Arrhythmias can cause death. So things like ventricular tachycardia, ventricular fibrillation, torsades, which is a type of ventricular fibrillation, but it's specifically related to alcoholism. Those are things that they can try to save you with a defibrillator. They can shock them. They shock you. They can get you medication. Sometimes it's due to they can get it to stop for medication. Blood thinners for 12 hours, morphine or Demerol. They also, if it's caused by a clot, they can give you what's called TPA, and this dissolves the clot. They can also use cardiotonic drugs to slow your heart rate and make it stronger. So your heart doesn't beat as fast, but it beats a lot more strongly. Other medications that they give people who have heart problems are beta blockers. Beta blockers slow down a rhythm that's going too fast. Diuretics, which cause you to lose fluid because maybe your heart is working really hard because of the fluid that you're retaining. Also, you can retain fluid because your heart's not working hard. It's you're in heart failure. They'll give you diuretics to lose that fluid, and also anticoagulant therapy. If you're somebody who has had a clot, they will give you an anticoagulant so that your heart you don't develop clots. They can also do things like we talked about in class, like coronary artery bypass graft or CABG. They can do an angioplasty too. An angioplasty is done when they thread a little wire through your heart vessels and they expand it with a little balloon, and we'll go into that a little bit later. Infectious diseases of your heart. We talked a little bit about this. Pericarditis. It's when you get an infection in your pericardium, you start to build up pus in between those layers. Remember, there's a visceral layer and a parietal layer. And then your heart is not it's not able to contract properly. That infection causes swelling and fluid in the sac, and the heart is restricted in its contraction, and that reduces blood flow. That can be a sharp stabbing pain. It's usually felt obviously on the left side of your chest, behind your sternum. A lot of people are already sick. You'll see they'll have a cough, difficulty breathing, rapid pulse, and fever, because pericarditis is an infection, so you're going to have a high fever. Myocarditis is an inflammation of the myocardium. Same symptoms as a pericarditis. And endocarditis is an inflammation of the endocardium, which is inside the heart, and that covers the membrane and the valves. It can form rough spots that can lead to the formation of a fatal blood clot. Remember, we talked about how plaque in the arteries can cause a rough spot and things get caught on it, platelets get caught on it, form a clot. Same thing with inside the heart. It will form a blood clot called a thrombus, and that can get pushed through your arteries, into your body, or it can go into your body to your brain. It can go to your lungs if it's the right side of the heart. It can be deadly. Rheumatic heart disease is from frequent strep throat infections during your childhood, and when you have untreated strep, you can get what's caused rheumatic fever. Antibodies that form from the infections attack the lining of the heart, especially the tricuspid and the bicuspid valves. This leads to them becoming scarred and inflamed, and then they're not able to work properly. The mitral valve is unable to close, and you have now a mitral valve prolapse. Uh, you have regurgitation of the blood. Some of it's being pumped backwards into the atrium so that it's not going to the aorta. It's important to treat strep throat when you have it. Okay, so I went a little bit over on this one. It looks like we have heart failure next, and I'll be back with that.